Hello everyone, welcome to Dr. Chan's Medical Ailments Forum today. So the topic that I'm going to talk about is BLS, or the basic life support for child. In particular, what to do when you see a child or an infant choking. So the reason that I chose this topic is because I went to an NCT class today, and among the ladies there, they were talking about, oh actually I don't quite know what to do if my baby is choking. That's quite scary. So I thought I would just spend a few minutes talking about, number one, how to recognize a baby or infant is choking, and number two, what to do. Because obviously time is essence. If a baby is really choking, they get asphyxiated so quickly, so you need to know some basic skills to kind of sort out the choking to save time and life, of course. So number one thing is we need to be aware what is choking. So if you actually have to describe choking, I would say that is characterized by sudden onset. Quite a lot of time these children are playing or eating, and it's a respiratory distress associated with coughing. They might be gagging or even have stridor. Stridor is a sound that they make when something is obstructing the airway. So it's a little bit like that. That would be stridor. Okay, so obviously there are similar signs. They're similar to choking, but actually caused by other conditions. For example, an infection like laryngitis or epiglottitis or something like that. But the difference would be the onset of these symptoms would be quite quick. And most of the time you know that there's a cue. For example, you're playing with the baby or the baby is eating something and suddenly they present with symptoms like that, and they are not unwell. So prior to that they were absolutely fine. So I would say when these symptoms or these signs come on, you can say, yeah, it's quite surely say that this infant or the child is choking. Now obviously knowing these symptoms, you need to know what to do. I generally divide them into two different bits, which is the kind of stuff that they teach on BLS for children, basic life support basically. So the two areas that you need to look into is, one, is the child coughing properly, or are they having an ineffective coughing? So option one is effective coughing, option two is ineffective coughing. So let's talk about effective coughing. What are you actually looking for? That's generally is a better sign if they're coughing properly. That means the air is still actually getting into their lungs, and if they're able to dislodge the obstruction, they will be fine. So things to look out for is they're able to cough, the cough is loud, they might be crying, and they're able to take a breath before they cough, and they're fully responsive. So these are all good signs, okay? So the management will be slightly different to the ineffective coughing. So in ineffective coughing, you'll be looking for a baby that is really quiet. They're unable to kind of make any crying noises at all because the air can't even get in or out. They might try to cough, but it's kind of silence. It's kind of like that, then you'll be more worried, okay? So obviously if they can't cough, they might not be able to breathe as well. They might look a bit blue around the lips, and obviously worse come to worse is decreasing of the consciousness or completely unconscious. So these are the two areas that we kind of need to differentiate first. So let's say you've assessed the situation and you say, oh, this child is coughing effectively. Then generally speaking, not much you need to do apart from encouraging the child or the infant to cough, and also continuously monitoring the situation and make sure that they're not slipping into the ineffective coughing, or if they're unconscious, then that would be different. You might have to do CPR and stuff like that, which we'll talk about later. But generally speaking, if they are able to cough properly, and you just need to keep on monitoring the situation until the obstruction is dislodged, okay? So let's say if the child's actually coughing ineffectively, but they're conscious, so then these are the few things that you need to learn about. I'm not going to talk about CPR just yet because I want to do a separate video, just trying to make things a bit simpler. So if you see a child who's choking and they are conscious but the coughing is not effective, what you want to do is to give them 5 back blows, okay? I'll show you how to do it. Ideally, this is obviously my demo, my favorite toy, and ideally you want to do it in a sitting down position and put the baby on your thighs, but you can't really see it from here. So just imagine that I have put my baby on my thighs but head down. So obviously gravity will help the food to be dislodged easily. So let's just do it like this. Just imagine that he's actually leaning on my thighs with the head down, but you need to support the head as well. Make sure that your fingers are not in the way of the soft tissue, because you would actually obstruct the airflow as well. So make sure that you are supporting on both sides of the angle of the jaw, okay? Just lightly. And you do 5 back blow. And every time when you do it, you need to make sure the food has not been dislodged, okay? Because you don't want to keep whacking the baby, even the food has been dislodged already. So 5 blow. And then you check, is he all right? Still not coughing properly. You want to flip him over, okay? Same old position, still leaning on your thighs, but head down, okay? This time round, we will do 5 thrust to the chest. We call it chest thrust. Similar to kind of CPR type thing, but it's slower. Okay, so it's you basically find the bottom part of the sternum, maybe 1 finger breadth away from the stiffy sternum, and then you just use 2 fingers and push down and up. 1, 2, 3, 4, 5, and every time when you do that, obviously check that there's no food coming out from the mouth. I know that's a temptation of people trying to see whether they can find any food in the mouth and trying to sweep it out, but it's actually a bad thing to do, especially before you do these, you know, back blow and chest thrust, because you can easily put the food back to the back of the throat and causing more obstruction. Okay, so we do the cycle 3 times, and if it's not working, you need to call for help, really. Okay, so if the baby is unconscious and is also choking, then we have to do CPR, but I would talk about that in a separate video. So the most important thing to remember is check whether the child is having effective or ineffective cough. If the cough is effective, you encourage them to keep coughing, okay? And keep on monitoring the situation. If things get worse, let's say if the cough become ineffective but still conscious, you do 5 back blows, and if it's not working, you flip him over or her over and to do 5 chest thrusts, and you do a cycle of 3. But actually, if you get a chance or get someone to call for help, that's most important, because you never know how things gonna go. So if you are able to dislodge the food, that's great. If not, then you always have to call for help, and I'd rather call for help earlier. So before you do that, always make sure you call for help first. Okay, so I hope that this video is informative, and if you need more information, you can go to Pediatric Basic Life Support online, and they've got a flowchart for you and teach you how to do these kind of BLS on young infants. And also you can also look online at St. John's Ambulance. They've got really good videos on basic life support for children as well. So I hope that you find this video useful, and the next video we'll talk about how to do children CPR. Okay, take care, bye bye.